Hello, welcome to the Morning Wrap. I'm Kalina Estrinos. May is Celiac Disease Awareness Month, and it's a disease that impacts millions of people in the U.S. Today, Dr. Suhail Salem is here to explain ways to identify it and work through issues associated with it as well. Welcome back to the Morning Wrap. May is Celiac Awareness Month, and it's a disease that's estimated to impact 1 in 100 people worldwide, but only about 30% are properly diagnosed. So here to tell us more about available treatments, what you can do, we have Dr. Suhail Salem here with me right now. Thank you so much for joining me.
Thank you for having me.
So I want to just dive in, first of all, what this disease is exactly and what it does to someone's body.
All right, well, it's a great question. It is an autoimmune disease, which means that your body's immune system has been triggered to attack part of your own body. And the trigger for that, most people are familiar with, is gluten. And so what happens is gluten and its byproducts of digestion get taken up by your small intestine, presented to your immune system. Your immune system responds as though this could harm your body, and in the process damages your small intestine.
Thank you for breaking that down for
Sure.
me. I feel like, I don't know if it's just me, but I feel like a lot of people are gluten intolerant. And it seems like we are just hearing more and more about people being diagnosed with celiac disease in general. What are some of the obstacles that they have to deal with, and what ways can they combat some of the daily struggles?
Well, I mean, the treatment for celiac disease basically involves being on a gluten-free diet, and
it's just as easy as that.
It's as easy and as hard as that, I would say, because the good thing is you don't have to take any drugs. There's no pharmaceuticals for it. The disease pretty much goes away in terms of the symptoms and the consequences of the disease if you are able to avoid gluten. And nowadays we have so many more options. Grocery stores and restaurants both present their foods as being gluten-free. It's not perfect yet, but a lot more options than we used to have.
What are some of the, I guess you mentioned consequences, but how can someone identify, okay, I think I have celiac disease? Like, what are some of the things that pop up that will let you know? So
first of all, you might suspect it based on symptoms. So diarrhea, abdominal pain, bloating, as well as nutritional deficiencies or weight loss. But talk to your doctor about it. We have very good testing for it. There's blood testing that can identify the antibodies associated with celiac disease. We have genetic testing that can determine if you're genetically predisposed to have celiac disease. And then we have endoscopy with biopsies of the small intestine, which helps clinch the diagnosis as well.
What are some of the long-term consequences if you do not get a diagnosis? I mean, we said that earlier, that a lot of people don't even realize that they have it or they're not getting diagnosed. So what if for some reason they went years and years and years, let's just say, without proper diagnosis, what could happen?
Well, the most common things would be chronic symptoms, diarrhea, malnutrition, nutritional deficiencies, but also in the most severe cases, some people are more prone to certain types of lymphomas that can affect the intestinal tract. That's quite rare, but that is maybe in the worst case scenario.
What are some of the things that you'd like people to know about maybe possible misconceptions or ways they can help other people possibly show some support?
I think people should understand how serious this condition is. I mean, every time these people consume gluten, their body is developing an inflammatory reaction against their intestine. I think sometimes people don't take it as seriously. I think if you're living in the same household as somebody with celiac disease, you can take steps to prevent cross-contamination of foods, keep dishes and utensils in separate cupboards that are gluten-free, clean home appliances like microwaves in between use, because cross-contamination is a significant contributor to ongoing symptoms and inflammation.
I've learned so much today. Thank you so much for being here. I really, really appreciate it. And we're going to hopefully put all of this up on our website in case someone needs some references or just more information.
Thank you so much.
So thank you. Come back anytime.
Thank you.
Perfect.